our smile and teeth project youth, good health, and sexual attractiveness. And when teeth are crooked, discolored, and misaligned, we subjectively react to a patient or a person, in a different way. And we may be distracted from what they say by the appearance of their teeth. And there are many options, including simple teeth whitening, orthodontic realignment, and cosmetic procedures regarding aesthetically improving the appearance of the teeth that we'd like to discuss today with Dr. Zachary Linhart, a expert in cosmetic and aesthetic improvements of our teeth. And he practices in Manhattan with his father, Jan Lindhart. Both are renowned cosmetic dentists and are recognized as nationally as top aesthetic dentists. And it's my pleasure to have him today to learn as much as I can about how to improve our smile and the appearance of our teeth. So, Dr. Linhart, I'm going to ask you the first question. How has aesthetic dentistry evolved? Your father has been in the field for decades, and you came in a little later.
Yep.
And has the philosophy of aesthetic improvement in the teeth evolved, changed, new technology? Tell us what we need to know.
Well, first I want to say thank you so much for having me, Doc. This is a real privilege and opportunity. And, as you mentioned, cosmetic dentistry has changed significantly over the past many years. My father, Jan Lindhart, works with me. We practice together. He's been a dentist now since 1979. He graduated NYU Dental School. And when he graduated dental school in the late 70s, there really weren't many cosmetic options for patients. The best option at the time was composite bonding, which is white filling material that's put on top of the teeth that can help cosmetically. But at that time, it was pretty new. Most dentists didn't know how to perform bonding. And really, the results were pretty lackluster. They tended to last only a couple of years and had to be redone. They chipped easily. And over time, through technology, advancements in materials, and techniques, we've learned to really perfect and enhance cosmetic dentistry. In the past, we've seen a lot of patients who come in with other cosmetic procedures done, some things that you may do, so some things that other surgeons do, creams they use, hair procedures, etc. And we've really been able to match dentistry to those other procedures. Nowadays, porcelain veneers are usually our go-to for cosmetics on patients who really want a new, rejuvenated, young-looking smile. And advancements in porcelain itself, bonding techniques to the teeth, as well as the techniques of dentist preparations have really allowed us to create magnificent young smiles.
That's great. We're going to explore those advances in a minute. Before we begin, I'd like to ask also, what's the difference between restorative dentistry and cosmetic dentistry? Are they one and the same, or are they basically merged together? For instance, in my practice, I do reconstructive eyelid surgery and also cosmetic surgery. And I think if you're good at cosmetics, you're good at restorative dentistry. I don't put them in two different categories.
That's a great question, really interesting. And we have patients that come in all the time and they say, well, are you a cosmetic dentist or are you just a general restorative dentist? And like you just said with your profession, it's really one and the same. Restorative dentistry and cosmetic dentistry go hand in hand. You can't do a beautiful cosmetic dental case, whether it be veneers or bonding or implants, without restoring the teeth to their natural form and function, or else you don't have a long-standing result. There are dentists who don't do a lot of porcelain veneers or cosmetic bonding. It's not really in their purview, but all cosmetic dentists are also restorative dentists. They understand that you're restoring the teeth to, the way they should be and to function properly.
But But there is a division, isn't there not, between like, people who have severely crooked teeth, for instance. You, as a say, as an aesthetic dentist, may not do like the orthodontic work on those patients, or if their gums are diseased, or if there's other issues. I noticed that your practice has a interdisciplinary group of people working
Yeah.
together.
Yeah, so
Um,
this is sort of a brainchild my father came up with about 10, 15 years ago, around when I was coming into the practice. And it's really fantastic. So in our office, which is in Midtown Manhattan, we have a in-house periodontist, which is a gum surgeon, an implant specialist. We have an in-house root canal specialist, also known as an endodontist. And we have an in-house orthodontist, she does braces and Invisalign. Then we have my father and myself and a couple of other general restorative cosmetic dentists. So when we have a complex restorative and cosmetic case, that patient will see our periodontist, they'll see our orthodontist, their gums will be healthy, their teeth will be as straight as necessary to achieve the proper result and health. If they need any root canals, they're done in our office, etc. So everything is done in one place. And it's taken the whole picture of dentistry, placed it in one office, and made an interdisciplinary approach, sort of like some cosmetic surgeons have formed groups where they have the entire line inside their office.
mhm. Well, that's less common amongst cosmetic plastic surgeons like myself, but um, I think that approach makes sense. I think that there are specialists in each realm, and they have their expertise in each realm, and they bring different expertise and viewpoints to the patient to get the best
Definitely,
results.
definitely.
While we're talking about results, I know that uh, we all want to achieve natural looking results,
Yeah,
and I've seen many patients over the years who've come in with what I call chiclets. You
yeah,
know,
we see them too.
their teeth do not look natural, and the question is, how do you differentiate your group in terms of your ability to achieve natural looking results?
Yeah, that's another great question. There's this reputation among lay people about cosmetic dentistry sometimes, about porcelain veneers in specific, where they call them chiclets or, big white bunny teeth. Um, and it's interesting because there's actually a little bit of a split in the country where a lot of West Coast dentists, cosmetic dentists the patients will ask for these big, bright, unnatural smiles. Patients will say, I want my teeth as white as possible, as big as possible. On the East Coast, it tends to be that people want natural, beautiful, sort of youthful looking teeth. Because
More
most of our
subtle.
patients,
Mhm.
subtle, exactly.
Yeah.
Most of our patients are, doctors, lawyers, bankers, working folk. They're not in Hollywood. They're not, they want to look natural. And while we can do everything in our office, and we sometimes have patients that come in that say, I want them super white, and we'll do it for them. It's obviously up to them. Our general goal is to achieve natural looking smiles. We want somebody to go out into the world, as I'm sure you do with your patients, and we want someone to, one of their friends to see them for the first time since they had their teeth done and say, wow, you look amazing. What have you been doing? You look great. We don't want
Mhm.
them to say, what did you do to your teeth? Or, wow, you got veneers. No, we want them to say, you look great. You look so young right now. You look awesome. We want that natural look. And in that natural look, we tend to make the teeth a natural color. We make them a natural length. We try to mimic what that person's teeth would have looked like 10, 15, 20, 30 years ago, but in a natural way that fits their face, fits their skin tone, fits their personality, their sex.
Oh,
All of these things are taken into
oh.
account.
So there's a lot of very interesting analysis that goes into the way you approach the patient in terms of looking at their whole facial composite, so to speak.
Definitely. Definitely.
Before we move on, though, we're using terms, and our listeners may not know what the difference is between, say, a veneer, a bonding, different kinds of veneers. Could you clarify that for us? what
Sure.
exactly that means?
Yeah, so the simplest cosmetic the first thing we can do is whitening. Well, just whitening is pretty simple. We have you into the office. We use bleach on your teeth. It's actually hydrogen peroxide, and it whitens your teeth, similar to the trays you use at home. But the simplest sort of restorative technique we use is bonding, also known as resin bonding, composite bonding. That all refers to white bonding material, which is exactly the same material that we use to do white fillings in your mouth. Using bonding, we can add to the teeth very easily. We basically prepare the tooth a little bit, either by roughening it or drilling into it, and we can just place that bonding over the teeth. We can make them longer, we can make them wider, we can make them whiter. But as many people know, with a white filling, the cosmetic result tends to only last maybe 5 to 10 years. Sometimes they dull. Bondings can stain over time. And it's very hard in somebody's mouth with saliva, with all the other factors, to get them to look really spectacular. That's why porcelain veneers were developed in the 80s. And porcelain veneers are made of porcelain by a lab technician. We have a lab technician we've been using for over 20 years. And porcelain veneers are lab made. So unlike bonding, which is done directly on your teeth at that procedure, for veneers, the teeth are prepared the first visit, and then an impression is taken, whether digitally or with putty, and given to the lab technician who actually fabricates the veneers, and then they're put in. So that's a
So what is a
in-lab
veneer?
technique.
I
It's
don't mean to
it's
be
basic.
I didn't mean I'm sorry to cut you off, but I mean I understand bonding, which is
Yeah.
material that you place on the surface and it bonds to the underlying tooth. A
Yeah.
veneer is what though exactly? I don't really
Veneers,
quite understand.
it's literally porcelain. It's
Porcelain.
porcelain. It's like a porcelain, almost like a tile that's placed on the front of the tooth.
Ah,
A
okay.
very thin, about a half a millimeter thick sheet of porcelain that the lab technician makes. If you took a porcelain veneer, the little sheet by itself, and you squeezed it, it would crush. It's sort of like a tile. If you took a tile and you hit it on the floor, it's going to break. But once you
Got it.
bond it to the floor of the tooth, it becomes very hard
I see.
and beautiful looking, because as you know, porcelain has beautiful white translucent characteristics to it.
I see. And so um there are other types of veneers like zirconium and some other materials. What else do they use? Why would they use those other materials?
Yeah, so over the past maybe 10, 15 years, originally veneers were all made out of something called feldspathic porcelain, which is a beautiful translucent porcelain, but it's pretty fragile. As I said, it will break if you squeeze it in your hand. Over the past 15-ish years, they've come out with some other materials. One you mentioned is zirconia. Another one is called lithium disilicate, also known as Emax. Um, and there's a few others, Empress and some others, that just have different characteristics. For example, zirconia, like you mentioned, is very strong. So if we have a patient who's a grinder or bruxer and they grind their teeth, we may do crowns, for example, out of zirconia. Veneers, we tend not to use zirconia as much because it doesn't bond to the tooth as well as porcelain. Lately, people have moved away from feldspathic porcelain, the original porcelain that we use, more towards Emax, which is about twice as strong as traditional porcelain, and looks pretty much as beautiful. But those two materials, porcelain and Emax, are sort of the two most common veneer materials.
And how long does this stuff last? I mean, is it for a lifetime, or do you expect after 10 years it's going to degrade?
So we normally tell our patients that porcelain veneers last anywhere from 10 to 20 years.
Mhm.
But that, again, I came into a practice with my father who's been practicing since 1979. He has a lot of patients that he placed porcelain veneers on in the 80s, late 80s, 90s onward. And we see cases now that he placed the veneers in the 80s and they're still on there and look spectacular. So it really varies. A lot of times we'll end up redoing veneers after, say, 15, 20 years, not because the veneers are failing in any way, but because as you get older, your gums recede. So sometimes you'll start seeing more tooth up by the gum line, which tends to be yellow because it's
Mhm.
your root, which is yellow.
Yeah.
Sometimes after 20 years, they just have dulled out because, again, the teeth behind them have become darker, et cetera. And patients come in and they say, you know what, I've had these for 20 years. They've been fantastic. Let's redo them and freshen them up. So
Yeah.
usually it's not because they fail. It's just sort of time to redo them.
But And let me ask you this question. I know it may sound strange, but like if you put on a nail, a, a, a woman who goes and gets their nails done, and they have these
Yeah,
little applications of fake nails on top of their nails, they
yeah,
tend to get the nail itself doesn't breathe, and it tends to get a fungus underneath.
yeah.
What happen? I know there are little pores in a tooth, and what happens if you put this veneer on there? Does it cut down on the kind of the viability of the underlying tooth?
That's a great question too. So the veneer is basically bonded to the tooth with the same bonding technique we use for bonding or any other bonding in dentistry. Um, and it's really bonded in a way that's a fantastic seal. That's one of the technique sensitive parts of dentistry is bonding that veneer to the tooth. Um, so if it's done properly and really well, it should last a long time and really nothing gets under there. Now you can get decay under a veneer just like you can get decay under a filling. You can get decay under a crown. You can get decay on your own tooth, and that's why people need fillings. But it's really a technique that, if done properly and done by somebody who does it on a daily or weekly basis, we typically don't have issues. It, if anything, can strengthen the tooth because it adds this fresh layer of porcelain over it rather than weaken the tooth when done properly.
I see. And in terms of color, I know is choosing the right color, is that part of the art of that separates the good from the bad, so to speak?
Definitely. It's about color. It's about, like I mentioned before, matching the patient's face and the
Size?
skin tone, size. So the way we do porcelain veneers in our office, which again are the big cosmetic technique that we do a lot of and we're sort of known for, that my father is one of the pioneers of, um, is that we actually take an impression of your teeth before we even start doing anything. And our lab technician waxes up what we want the teeth to look like on the model of your teeth. Then we use that final wax up, the mock up of the teeth, to make our permanent teeth. So once we prepare your teeth for the veneers, we make temporaries using that mock up. And when you're in those temporaries, we have every patient come into the office. They meet with me and my father, and they meet with our lab technician as well, the person who's actually making the porcelain veneers. And we discuss, do you like the way that the temporaries look? Do you like the shade, the color? Do you like the size? Do you want
Oh,
them perfectly straight? Do you want them a little less straight? Do you want it broader or less broad? And we discuss all that and take notes on it. And then our lab technician makes the permanent veneers according to those specifications. And we could also modify the temporaries in the patient's mouth. If they say, I'd love my teeth to be a little longer, we could actually take bonding material and just add a little onto the temporaries and say, well, this is what they'll look like if they're longer. And the patient may say, you know what, I like them better the way they were before. And then we could just take that little bit off. And once we get it perfect, they say, I love them just like this. We take another impression, we give it to our lab technician. He's taken down all the shades and colors and sizes and notes he wants, and then he makes the permanent veneers.
oh, so it's very interactive in terms of how you decide the size and shape and color. It's
Exactly.
fascinating to me because teeth is I mean the mouth and the teeth obviously are the domain of the dentist, and yet so many cosmetic surgeons leave that out in terms of their analysis of the whole aesthetic improvement of a patient's face. And I really believe that it's like an area that really many cosmetic surgeons don't address and kind of glance over, so to speak.
Yeah.
You were talking about making molds with wax. What about 3D printing? Is how does that impact your analysis?
Yeah, I'm glad you asked. In our office, we have a lot of really cool technology that we use. We have actually three intraoral scanners, which allow us to scan your teeth, whether it's your own teeth or preparations. Um, and those create 3D models, digital models of your teeth. So instead of the old way, which we still use as well, which is sort of the gold standard, we use both, but instead of taking those goopy impressions of your teeth, we can scan the teeth with these 3D scanners. And then using that scanner, we can mill restorations in the office. So we can mill crowns and inlays and onlays and veneers in the office if we choose to do so. And we could also mill or print a 3D model using our 3D printer of your teeth. So all these technologies are adjuncts. They make a lot of things a lot easier for the patient and for the dentist, and obviously communication with the lab where we can send a scan over to them instantaneously and discuss it. It's pretty cool technology, and we use a lot of it. But we also do still use the old techniques as well. We use them in tandem one another.
Mm-hmm. Let me just a second. Now, how does the size and teeth and bony structure of the teeth affect the overlying soft tissue? In other words, in my practice, I see patients who come in, they want lip augmentation, for instance. Yeah. And I always say, and I thought I was being very clever, not clever, but very, I always looked at the teeth. Yeah. And I said, your teeth are your structural support for your lips. Yep. And I not uncommonly would see people who have gum recession or small teeth, and they start forming these vertical lines in their upper lip, particularly, or the length of their lip from their bottom of their nose to their vermilion border was getting longer. And in those cases, I might recommend a lip lift or some procedure like that. So how do you, what do you tell the patient in regard to their perioral aesthetic, perioral aesthetic changes that are occurring as they age?
Yeah, I mean, there's no question, as you just mentioned, that as people age, their lips tend to shrink in. They tend to get wrinkles up on the top and bottom. We've all seen the old grandma or grandpa or the personification of them where their lips are sunken in because they have no teeth left. They take their dentures out and their teeth sink way back. With cosmetic dentistry, as you just mentioned, the teeth support the lips. If you were to take out all your top teeth, then your lip would sink way in and you'd look like a very different person, not as handsome as a person. So, when we're doing cosmetics, we want to make sure to keep those teeth where they're supposed to be, or even push them forward in order to support the lip properly. Especially with as people age and their teeth get shorter and their teeth get beat up, their lips tend to shrink. So we want to bulk them out. We also want to make sure the length looks natural because, as you mentioned, a lot of people get recession as they get older, which can make your teeth look long. And we want the teeth to look natural and the proper length. And through different tricks we can use with cosmetic dentistry, we can make the teeth look a natural length and not overly long.
So how do you do that? Can you tell us simply how that would be done?
Basically we can, so the porcelain that we use for teeth is not, when somebody says, I want, this shade, we decide it with our lab technician, as I mentioned. The lab technician doesn't take shade X and make the whole veneer out of shade X. They make the edge of the tooth tends to be a little translucent, the body of the tooth tends to be a little white, and then the neck of the tooth tends to be slightly yellower as it fades to the gum line. So we could extend that yellowness or that natural hue up to the gum line to make the tooth look a certain length. He may use 20, 30 different shades of porcelain in making that tooth to make it natural looking.
So I can see that there's really an art to the whole thing. I mean, I'm really impressed at how there's subtle. It's not that, as I said before, this white chiclet and veneer of the past that made all these people look artificial.
Exactly.
Now that gradation is so impressive to me.
Yeah, it's a huge part of it, and it's something that we tell our patients when they are consulting with us about doing their teeth, and they say, well, why should I go with you instead of someone else, or why should we do this instead of that? And it's really between our lab technician, us the dentists obviously, and the experience of doing this so many times that we've really perfected the art. We don't switch to new materials unless we know they're going to be as beautiful and strong as the old materials. one of the disadvantages of some of the new materials like zirconia that you mentioned is it's very hard to gradiate the porcelain on it because of the material. Zirconia is much less translucent than porcelain. So porcelain, you leave a lot of translucency, so that yellow hue, that beautiful yellow hue, shines through your tooth and it looks natural. Because the porcelain, if you took a veneer and held it up to the light, it would almost be transparent. It's very, it's transparent. It's not completely transparent, but you can see through it. Whereas some of the newer materials, translucent, yeah, it's probably a better word. Translucent, that's the word I was looking for. Whereas a lot of the newer materials like zirconia is stronger, but it doesn't have that translucency. And if you don't use it properly, you end up with some of those very chalky, chiclety looking teeth. So it's very technique sensitive. Porcelain veneers, from my experience in dentistry, which is, not as long as my father's or yours, but it's been 10 plus years, porcelain veneers are the most technique sensitive thing we do, between the preparation, working with the lab technician, and the bonding of the teeth and the patient's expectations. When you do a crown in the back, nobody really looks at it. Nobody cares as long as it feels comfortable and it's in there and it lasts. They're fine. When you do veneers, if they don't look right, you have a very unhappy patient and a lot of work to redo them. So we try to avoid that at all costs.
I see why there's a lot of pre-testing before you actually go for the final result.
Exactly. We want to make sure it's right. Yeah. Once the teeth are in there, once veneers are bonded after that final visit, in order to get them off, you have to cut them off. You have to destroy them and remake them. It's a huge process that you don't want to do, and so you haven't done very often.
Yeah, you got to make sure you got the right color size and everything for the patient's face. In terms of what do you one last question, and that is, some patients come in with what I call gummy smile.
Yeah, that's where you come into. That's where we use you to lower their lip a little bit.
Well, I was just wondering whether or not you folks use any Botox to do that.
We do some in our office. Dentists can be certified to use Botox. One of the great things about dentistry is, even with the specialists I mentioned, as long as a dentist feels comfortable. If I feel comfortable doing Invisalign or braces, I'm allowed to do it as a general dentist. Sure. I place implants as a general dentist, so we're allowed to do a lot of things as long as we feel comfortable. And obviously, if you do something and you're not supposed to be, or you're not skilled enough to do it and something happens, then you're liable. But we do some Botox in the office on the upper lip, so that a lot of people have a hypermobile lip. I'm sure you see them where they smile and you see their teeth and then a lot of gum, and it looks like they have a super gummy smile. And Botox can help a lot with that. There are some surgical techniques that can help, but Botox is a very easy, quick solution that we do a decent amount of it in our office.
Okay.
Really turns out
interesting.
Nice. Something we definitely do.
How about implants? I know you do implant surgery. Does that fit into the cosmetic realm as well?
It definitely fits in when the implant is in the cosmetic zone. Those front 8 to 10 teeth. An implant is basically a replacement of a lost tooth. So if you were to get a tooth traumatized or broken or decayed to a point where it's unrestorable, that tooth, the entire tooth comes out and an implant goes in. And one technique that we've sort of perfected in our office and is becoming more common is called an immediate implant, where if you were tomorrow to get, God forbid, hit by a baseball bat, which we see, a lot of people that come in like that, and you lose one of your teeth, we can actually take the tooth out. We can place an implant, which is like a root, into the bone, and we can put a temporary on top of that implant, all in the same visit. So you can come into our office with a broken tooth, and you'll leave with a tooth that looks as good as what you lost before, and it looks spectacular. And then about 6 months later, once the implant is fully integrated with the bone, because that implant needs to integrate, then we put a permanent crown on top of it. But in the meantime, we could put a temporary that really looks spectacular. Instead of having to wear something removable that you take in and out for 6 months.
I got it. Well, I think we wrapped it up, and I want to thank you, Dr. Linhart, for being with us today. And it's been very enlightening to me, and I hope the people listening also were enlightened on the advances of aesthetic dentistry, the sophistication, and the artistry that goes into achieving great results. So thank you again for being my guest, and hopefully people listening will enjoy it.
Yeah, I hope so too. Thank you so much for having us. And, if anyone has any questions about cosmetic dentistry, just reach out to Linhart Dentistry. Again, we're in the Helmsley building right in Midtown Manhattan.